You're listening to Ask Dr. Jake. My name is Dr. Jake Tucker, owner and founder of Good Life Family Chiropractic here on the south side of Lincoln, here at the corner of 56th and Pine Lake next to Campbell's Nursery. Our office, you can reach us at 531-289-7100. Also, if you have a question for me, feel free to text us at 531-289-7100. And today we're coming to you, as we do every weekday, with another message of hope, health, and wholeness. And really, that starts with understanding what health is. In fact, that's the biggest obstacle to you achieving true health, right? Have you ever gotten on the interstate and without knowing exactly what the right directions were, started heading down I-80 going west? Let's say you're trying to get to Miami. Your intentions are fully focused on Miami, Florida. If you traveled down I-80 west, following all the traffic laws, going as fast as you can go legally, how long will it take you to get to Miami, Florida, going on I-80 west? And the answer is you won't ever get there. Unfortunately, the same is true with health. If you have every intention of being healthy and you get going the wrong direction, even with the best of intentions, if you've been given the wrong advice or just not enough information when it comes to health, then you're not going to get there. And so ultimately today and every single day, that's what I want to do is I want to reveal to you what it takes to be healthy and well, and then walk you through a plan to actually get there. Whether you're a regular radio listener and you get that from tuning in every single day, just pick up a piece of pen and paper and take notes and learn something new every single day. Or we're adding something new in by becoming a patient here in the office. And let me tell you, we see patients from as far away as Omaha and Fremont and over in Columbus, and we have patients coming from Seward, and we have patients coming from south of us in Crete. No matter how far away you are, know that this office may be your best bet if you truly want to be healthy, because we're going to address the cause of health, the cause of sickness and disease in your body, and the interference to expressing that life and health. And let me tell you, no matter where you're at today, you have that hope. In fact, I was one of those hopeless people, and I was a helpless baby. I was given a clean bill of health coming out of the hospital right after I was born. At 2 weeks old, I had my first well visit. I was given a clean bill of health there, but that same day, I quit breathing for the first time. And if you've heard this story before, you know that my mom took me to the emergency room right off. They sent me to specialists. I went to over a dozen different specialists, and nobody could give me an answer for what was wrong, let alone any hope for correction or treatment. And it wasn't until my mom's best friend told me to get to told her to bring me to a chiropractor that we began to have any hope at all. My mom left the University of Michigan Children's Hospital with basically a death sentence, being told that I essentially had SIDS and it was just her vigilance that was keeping me alive. But when that chiropractor took a look at me, he knew exactly what was wrong. One eye was open larger than the other. One pupil was dilated larger than the other. My head was cocked over to one side and I wasn't breathing well. Through those 4 symptoms, he was able to direct that back to one specific area of my body that had been affected at birth. I had a C-section. Like many children in this country, over a third of Nebraskan babies are delivered via C-section. It's one of the most traumatic experiences an infant can go through is a C-section delivery. And whether that's a severe intervention where I've heard things as bad as mom being put on an inversion table and multiple doctors grabbing onto the baby and pulling by the head, neck, or feet, and nurses holding the mom down, to just pulling out as quickly as it can, one doctor, one nurse, and everything being fine. Ultimately, what we're seeing from a C-section is a force being placed on a baby's neck, similar to a whiplash type trauma. And this had done such a number on my neck that it had wrapped Atlas, which is supposed to be perfectly parallel with the skull and the floor both, around my brainstem, twisted, tilted, and crushing not just the respiratory center in my brainstem, but those cranial nerves as they exited out. He did one adjustment, and my mom said that after that first adjustment, I've never had a breathing problem since. And that literally changed and transformed my life, such that some of these stories that you hear on a daily basis with people, getting out of pain and being able to sleep again a whole night, people, reversing chronic conditions like heart disease and congestive heart failure, and patients that are struggling with inflammatory diseases, people with fibromyalgia or multiple sclerosis, people getting their hearing improved or their vision starts improving, all without any medical intervention and just focusing on what's causing it. If we can address the cause of your health condition today, we can begin to work that back, just like the chiropractor addressed the cause of my health condition those 30 some odd years ago. That's exactly what we want to do for you. And so if you're sick and tired of being sick and tired, if you're dealing with neck pain, if you're dealing with back pain, if you're dealing with headaches or sciatica, call my office, 531-289-7100. The first 5 callers today are going to get a 50% discount to come into the office, get an exam, do a digital nerve scan, and then take any necessary x-rays. And that's a really important process to understand, because that exam is far more focused than anything that you'll ever get a wellness check in a medical doctor's office. We are going to be looking at those things that are obstacles to your health, and then ultimately your health goals. Because as much as I want you to be healthy and fully expressing life to the full, as Jesus said in John 10:10, I've come that you may have life and have it to the full. If you don't want that for yourself, if you don't want to be well, then there's nothing I or anyone else or even God can do for you. You have to want this for yourself. If you want it, then what we're going to do is we're going to identify those goals that you want to achieve. And then we're going to identify the obstacles that are in the way of you achieving those goals. The number one being any health conditions that you're dealing with. If we can overcome those obstacles through identifying the cause of those and starting to work those back, we will. The biggest obstacle I see is in the central nervous system. So we'll give you a thorough nervous system evaluation. Most medical doctors will not even assess your nervous system until you have a severe neurological deficit. And at that point, they're referring you out to a specialist for a multi-$1,000 office visit, multi-$1,000 testing, sometimes imaging to coincide and support their findings. And then what are they going to give you for a treatment? They're going to give you a medication to suppress your symptom. No medication ever cured a patient of anything more than a symptom. Medications are not designed to cure, they're designed to treat. If you want to be well, we have to start allowing your body to heal and function the way that God designed it to. And that starts with removing interference from your central nervous system. So if you haven't ever had your nervous system checked, let's start there. Call our office, 531-289-7100, and we will be happy to talk you through the process of setting up an appointment, getting that discount for you and any family members that need to get checked as well. And again, that number, 531-289-7100. And I wanted to walk you through what that process looked like for my dad. And you can, if you're following along on Facebook, and you can always find these shows in video form on facebook.com/AskDrJake. And I'll post these at 9:30 right when the show starts airing on KCRO, so that you can follow along live. If I'm showing any images and you want to understand better what's going on, you want to see my lovely face, I've been told I've got a beautiful face for radio. But yeah, you can see these off to the side. So my dad came down to meet my son, and the first Tucker grandchild ever born into his family, and he wanted to meet him. And so he drove all the way from Michigan down to Georgia, where I was practicing at the time. And I could tell as soon as he got out of the car that he was very unhealthy, that he was dealing with a very bad health condition. He was over 100 pounds overweight. So obesity, number one risk factor for virtually every disease that we know kills Americans, everything from COVID all the way through heart disease and diabetes and cancer. Obesity is the number one risk factor. So he's over 100 pounds overweight. And then number two, he's lost all color in his face. His lips and tongue have gone gray. He's got color in his ankles, but it's the color blue. His ankles are swollen on top of being overweight, and he's huffing and puffing by the time he gets to my front door. And so, he hasn't been to the doctor's office in years because he's working over 80 hours a week, working himself to the bone, not giving himself any time or investment into his health. And I have to sit down with him after I greet him and let him know how happy I am to see him and show him his new grandchild. I have to let him know that he's essentially got congestive heart failure, that his heart is starting to fail. It's backing up into his lungs and pooling in his ankles. And so we start talking about health, and we start talking about the causes of sickness and disease, and start talking about how, most of these things are lifestyle. Very few, according to the Journal of Pharmaceutical Research, less than 5% of all cancer cases are genetic. 95% are lifestyle preventable from those life choices that we make, those things that we do, our diet, our exercise, stress to the nervous system, stress to your emotions and your psyche, and just all these different things add up to either sickness and disease or health and well-being. And he said, yeah, no, all these things are working against me. Every single one of these essentials that you're talking about is being important for me to invest in. I'm literally attacking them through the things that I'm doing with my lifestyle. And so I said, okay, so let's start with the most important one. Let's start with the central nervous system, because when we talk about health and how the body heals, it's through the intelligence expressed over the central nervous system. For your heart to beat, for your lungs to breathe, for a cut on your leg to heal, a signal has to travel from your brain, run down the spinal cord, and out the nerves to every organ, cell, and tissue. If you want your heart to be healthy, it has to be getting a signal from your brain to be able to do the right thing at the right time in accordance with the stress that's placed on it. And so he said, okay, so how do I do that? And then we walked him through this test. We checked his posture, his range of motion. We found those limitations. I felt his spine to see where vertebra would be out of place, putting damaging pressure on the spinal cord or brainstem or the nerve roots, the most sensitive areas of pressure. We found that there was incredible stress across his shoulders. I saw a head forward posture. And so, all these things, we did a digital nerve scan. And what we found in the nerve scan was, again, a severe neurological pressure, especially in the areas that control the function of the heart. And as we saw that, we began to develop a plan to work this backwards. And so if you're watching on Facebook, you can see what I saw on X-ray. And so what it is, for those of you that aren't looking right now, is actually he's got the biggest risk factor here for cardiovascular disease, head forward posture. The X-ray on the left shows us he had over 2.5 inches of head forward posture. Every inch that your ear goes forward from your shoulders adds about 10 pounds of stress across the area of your spine where the sympathetic nerves exit out and control the heart. And so he was dealing with more stress in his neurological control of his heart than he should have been able to. And it was leading itself to a dysfunction in his heart and ultimately leading to these symptoms that we know and diagnose as congestive heart failure. And so I sat down with my dad and I said, look, Dad, there's 4 things that we can do with this. And, write these down. If you're listening right now, write these down. The first is we can do nothing. If we do nothing, do we expect this to get better or worse? And absolutely, it just makes sense, logical sense. If we do nothing, this gets worse. Second, you've got congestive heart failure. You have high blood pressure. You probably have a cholesterol issue as well, although we can't tell this on a test like this. If we take medications to cover up those symptoms and signs, are we going to ultimately get healthier, or is this level of dysfunction going to stay here? Right. It's not going to help the function. It's just going to address the symptoms. This is why we see people dying of heart disease on these medications all the time. Third thing that we can do is we can address the other 4 essentials. We can eat right. We can exercise. We can decrease emotional stress. But if we don't address this head forward posture, the arthritis that's sitting in the joints where we're seeing decreased disc space, where we're not getting enough movement, that's ultimately going to decrease the signals and the function going through your central nervous system. What do we have to do? Well, we have to address that. And he did. And as he did, he got healthier. You can see the transformation that he underwent from before to after, and you can see the effect that had on his life. My dad is congestive heart failure free, and that's what I want for each and every one of you. If you want to be healthy, call our office at 531-289-7100. And whatever your health problem, we're going to work through what we can do for you. I'm Dr. Jake. I'll see you again.